Hello, this is Dr. Chhavi Bansal and I am practicing homeopathy at HomeoSure, Home of Homeopathy and Wellness, Pitampura. Today I will be discussing about hypertension, which is the most common emerging lifestyle disorder these days. Hypertension is defined as elevation of blood pressure. Blood pressure is the pressure of flowing blood on the inner walls of the blood vessels, and it depends on various factors like the pumping force of the heart, the resistance of the blood vessels, and the amount of the blood flowing through the vessels. As I have previously told, it is a lifestyle disorder. Its development has been attributed to various lifestyle changes like poor diet, lack of exercises, lack of sleep, poor sleeping habits, work stress, mental stress. It is often termed as silent killer because in majority of the cases, its symptoms does not manifest in beginning of the cases, and it usually manifests itself with the complications only. Also, many people don't give importance to hypertension until unless they develop complications. Hypertension can be of two types, primary or essential or secondary hypertension, depending on the causes of hypertension. In majority of the cases, almost 90 to 95% of the cases, there is no underlying medical cause to hypertension, and this hypertension is termed as primary or essential hypertension. Secondary hypertension is the one in which there is some underlying medical condition which needs to be treated there. Now coming to the risk factors of hypertension. Risk factors of hypertension can be modifiable and non-modifiable. The non-modifiable factors include age, like hypertension is more common in later ages, race, it is more common in African Americans, and genetic. Hypertension has been found to run in families. And the modifiable risk factors are obesity, smoking, much intake of alcohol, caffeine, fatty food, higher levels of cholesterol, high sodium diet, low potassium diet, prolonged stress or prolonged use of OCBs. Now what is the harm of hypertension? Prolonged hypertension can develop many complications. It can damage your eyes, it can damage your kidneys, it can damage your heart, leading to various diseases like loss of vision, kidney disorders, heart diseases and stroke. Now coming to the prevention or the treatment of hypertension. As has been previously told, there are a lot of risk factors which prone you to develop hypertension. So prevention is the best treatment of hypertension. If the risk factors are controlled, it will definitely control your hypertension or at least delay it. So the best prevention would be to have a healthy lifestyle, which includes cutting down your alcohol and caffeine intake, quitting smoking, maintaining your weight, adding physical activity to your routine daily, decreasing your sodium intake, increasing your potassium intake. Homeopathy has wonderful results in delaying hypertension and controlling hypertension. If you have any further queries related to hypertension, feel free to consult me through Liberate.